Thank you for joining us for this presentation of the 2025 Health Plan Comparison. We want to help you understand how to better use the plans to fit you and your family's needs. During this presentation, we will discuss the two health plan options we will be continuing in Plan Year 2025. They are the Consumer Driven Health Plan, or CDHP, and the Point of Service, or POS plan. And we will do a comparison of the two plans where we will explain what is same about the plan versus what is different about them. We will also go over plan services and features. So sit back, relax, and let's get started. The first important point to remember is that we will be continuing to offer the same two health plans in 2025. The Point of Service, or POS plan, allows you to choose in or out-of-network care and services anytime. The Consumer Driven Health Plan, or CDHP, also allows you to choose in or out-of-network care and services anytime. And if enrolled, it allows you to use a health savings account or an HSA to pay for a wide array of eligible health care expenses directly. With the consumer-driven model, you will be more cost-conscious when utilizing services. Both plans permit you to decide how, when, or who will manage your health care needs. We will dive more into the design a little later in this presentation. Let's review the similarities, or what is same about both plans. To start, it's the negotiated fees. Sentara negotiates fees for services with providers on your behalf. Because of this, you can have confidence that what you're being charged may be lower than if you did not have insurance coverage. Meet Janice Jones. She's enrolled in the POS plan. Janice was wondering how much the cost would be if she was seen by her primary care physician. The negotiated rate is the discounted amount providers charge Sentara members for these services. You can see that the amount her provider normally charges for an office visit is $275. For an office visit, the negotiated rate would be $159.95. Of this $159.95, the City of Virginia Beach or Virginia Beach City Public Schools would pay $136.95, leaving Janice responsible for paying her $20 copay. That's a savings of $118.05. In addition to the negotiated fees, both plans also offer 100% of the cost of preventative services. Listed here are some of the services considered to be preventative and covered at 100% by the health plan, meaning you are not charged for them. Also listed are preventative pharmacy services, which are not subject to the deductible. This list is not an all-inclusive list. I want to briefly highlight some key components of a routine annual physical exam. An annual physical is when you see your primary care physician, or PCP, to review your health history, get lab work done, and it is a physical examination to determine the general status of your overall health. It gives you a chance to talk to your doctor about how you're doing generally. Now, I want to make you aware that during your physical exam, if you want your doctor to treat you for a specific symptom, maybe you're having neck pain and soreness of your throat that's getting worse. If you have it diagnosed or additional lab work or x-rays are needed, the visit would no longer be considered preventative, and you would be responsible for any copay or coinsurance cost of that visit. What began as your annual physical exam has now become a diagnostic visit, and the same would apply to any lab work or x-rays during that visit. We want you to be aware of this so that you understand how to use your health plan services effectively. Now, getting back to the similarities, you will have access to the same network of physicians on both plans. The network of physicians include the Sentara Health Network, which is a regional network that includes all area hospital systems. The PHCS network, or multi-plan network, which is a nationwide network of physicians with 90% of hospitals and doctors participating. The Sentara Quality Care Network, or Sequin, which is a network of doctors and facilities who deliver services focused on quality, performance, efficiency, and value to the patient. And the MD Live Virtual Care Network provides you board-certified doctors and therapists that are just a phone call, mouse click, and finger tap away. The last of the similarities I want to highlight is that both plans will provide the same high-quality coverage for the same services. It is important to remember, as neither plan is better or worse than the other. However, the out-of-pocket costs at the time you receive services will be different between the plans, and we will review this shortly. This presentation captures a short version of covered services. A full summary of benefits for both plans are available on the Consolidated Benefits Office website at benefitsatthebeach.com. Now, both plans will also provide you with the same condition management program. With Sentara Health Plan, you have coverage for colorectal cancer, diabetes, hypertension, asthma, chronic obstructive pulmonary disease, or COPD, or congestive heart failure. And under the Be Well program, programs such as diabetes, respiratory, cardiovascular, rare chronic disease management, as well as partners in pregnancy. Both plans will include vision care as part of the health plan benefits. No need to pay separately for these services. Taking care of your eyes are just as important as getting your annual checkups. Both plans provide the same prescription drug coverage and pharmacy providers. The first is by using a preferred pharmacy, which are Walgreens, Walmart, and Sam's Club, just to list a few. You will be able to get up to a 90-day supply at preferred pharmacies. You may visit any retail pharmacy. However, the copay and coinsurance are less at the preferred pharmacy. Express Script home delivery are also available and a great option for maintenance medications such as high blood pressure and cholesterol. Your medications may cost less, and you will get refill reminders when signing up for home delivery. You can also have access to the specialty pharmacy with Proprium for any unique or complex prescription needs, and home delivery for a 30-day supply is available. Now let's discuss the differences between the CDHP and the POS plans. There are three important differences that we will discuss in more detail. First, the plans have different eligibility for pairing with the health savings account. Second, what you will pay in premiums is different between the plans. And third, what you will pay at the time you receive services will be different between the two plans. The CDHP will allow you to also participate in a health savings account or an HSA. With the point of service plan, you will not be able to participate in an HSA. The greatest benefit to the CDHP is that, if eligible, the City of Virginia Beach and Virginia Beach City Public Schools contributes in a prorated payment towards a health savings account for you. It's $750 for subscriber-only coverage and $1,250 for all other coverage tiers. The next difference I want to highlight is the difference in premiums between the CDHP and the POS plans. This slide will show the 2025 active city and school rates for those receiving the employer contribution, which is the majority. The employer contribution is the amount the city and school contributes towards your health plan coverage. I would like to bring to your attention the employees' premiums for the CDHP plan. As you can see, they are lower than those for the POS plan. We encourage those who enroll in the CDHP to put some of the savings and premiums into an HSA or FSA if you are not eligible for the HSA. This slide will show the 2025 retiree city and school rates for those receiving the employer contribution. Retirees receiving the employer contributions are city and school retirees who retire with 25 or more years of cumulative service from the city or the school, or city retirees who retire with 5 years of service and a job-related disability. This slide will show the 2025 retiree city and school rates for those not receiving the employer contribution. Those not receiving the employer contribution are city and school retirees who retired with less than 25 years of cumulative service from the city or schools, or city retirees who retire with less than 5 years with a job-related disability from the city. The last difference I want to highlight is the difference in what you will pay at the time you receive services between the CDHP and the POS plans. Deductibles for the CDHP are a little different than the POS plans. The CDHP is a high deductible health plan that allows a health savings account to be integrated with it, and as such, it requires that all services are paid for by the member until the deductible has been met, except for preventative services. As you can see from this chart, the deductible for the CDHP plan is $2,000 for individual coverage and $4,000 for family. Another difference is what we refer to as a non-embedded deductible. I'll explain. Non-embedded means that you must meet the family deductible out-of-pocket maximum if enrolled in any tier other than subscriber only. With the CDHP plan, if you are enrolled in the subscriber-only coverage, you will pay for services up to $2,000 before the plan begins to pay. However, if you are in any other tier with dependents such as subscriber and child, or children, subscriber and spouse, or family, you must meet the family deductible amount of $4,000 before the plan will begin to share the cost of services. The plan will not begin to pay when one member reaches the individual deductible of $2,000 if the family has not met the $4,000 family deductible. Again, this is referred to as a non-embedded deductible. However, a few things to keep in mind or be reminded of is, as always, preventative services are covered at 100% before the deductible has been met. The CDHP features lower premiums compared to the POS plan. As we discussed earlier, you pay lower negotiated rates by having Centera insurance. Because there are no services covered before the deductible on the CDHP plan, any payments you make for covered services count towards meeting the deductible, except vision. Now showing on your screen is a brief summary plan description for the CDHP. Again, it does not show all the services the plan covers. However, it displays some frequently used services and is good for illustration purposes today. A deductible is the amount you must pay out of pocket before the plan begins to pay for services. The deductible for an individual is $850, and the deductible for the family is $1,700. However, there are a few exceptions. One example, let's say there are 3 individuals on the plan this time. Family member number 1 pays $850 for services out of pocket. They have met the individual deductible, and the plan will begin to share the costs for their services that they receive for the remainder of the plan year. This is referred to as an embedded deductible, meaning that the member on the family plan meets the individual deductible. The plan will begin to share the costs for their services even though the family deductible has not yet been met. Now, because the family deductible has not been met, the other family members must reach their individual deductible or reach their family deductible together. An example of the family deductible being met is if there are 4 family members on the plan, and family member number 1 has paid $700 toward services out of pocket, and family member number 2 has paid $600, and family member number 3 has paid $400. Your family will have met the family deductible for the POS plan of $1,700. For services that occur after this point, the plan will begin to pay coinsurance for services received by all 4 family members, even though the $850 individual deductible amount has not been reached by all. Under the POS plan, there are a few services that you will only have to pay co-payments for and will not have to pay towards or have met your deductible amount. You will see on your screen that these services have a superscript 1 next to them and include PCP, Specialist, or MD Live virtual services and maternity care. For pharmacy, Tier 1 and Tier 2 are copay, where Tier 3 are coinsurance. Now you have heard me talk about copays and coinsurance, so what is that? A copay is a flat dollar amount, like $20 that you would pay for certain services under the POS plan at the time of service. Coinsurance is a percentage of the total allowable amount or negotiated fee. So if the plan pays 85%, you will pay 15%. Remember, you can get in-network preventative care services at 100% without having to pay anything towards your deductible, when not considered diagnostic. Also remember that Sentara negotiates lower fees for services on your behalf. So, by having insurance, you are paying less for services even before the plan begins to share in the cost. For the POS plan, an individual would pay the first $850 for in-network services that do not otherwise have a copay or coinsurance covered before the deductible has been met. Those are highlighted now on your screen. The plan would begin to share the cost for these services after you have met your deductible. You will see a superscript AD next to these services. Most services on the POS plan are covered at 85% after the deductible. To learn more about the benefits in detail, you can visit the Summary of Benefits and Coverage, or SBC, available on our website. The family deductible under the POS plan is $1,700. Each family member will pay the first $850 for services that do not have a copay or coinsurance until the family as a whole has reached the $1,700 family deductible. For example, if you are enrolled in Subscriber and Spouse, both individuals would have to pay the first $850. However, for 3 or more individuals on a family plan, as soon as the combination of family members have paid the first $1,700, the plan will begin to pay the coinsurance for any family member on the plan having services. I want to highlight a few more points to remember about the deductible if you choose to enroll in the POS plan. Any amount you pay for services will count towards meeting your deductible, except for copays for PCP, specialist, and maternity care visits, and pharmacy copays. You will continue to be responsible for making the copayments for these visits even after meeting your annual deductible. On the POS plan, any monies you pay towards the deductible in the last quarter of the calendar year, so that's October, November, and December, will carry forward to the next calendar year and count towards meeting your deductible in that next plan year. Last note about the deductible: payments for out-of-pocket network services are accounted for separately and count towards your maximum out-of-network deductible. Before I end, I want to talk briefly about the maximum out-of-pocket, or MOOP. Both plans have maximum out-of-pocket amounts, and these are the most you will have to pay for healthcare services in a calendar year, so you are protected from catastrophic healthcare costs. For example, costs resulting from treatment for a heart attack or cancer. There are exceptions. You would have to continue to pay for certain services not covered by the plan after the maximum out-of-pocket, or MOOP, has been met. Should you need assistance with Sentara Health Plan and/or the HSA benefits, you will find contact information on the screen, as well as for the Consolidated Benefits Office. We are only a phone call away. I hope with this presentation you now have a better understanding of the two health plans offered, so that you can make an informed decision of which plan is best for you and your covered dependents. Thank you for your time and attention.